I have a personal enjoyment from teaching. If you ask me one word that describes me, and if you've ever thought about this about yourself, you should do so. If you say, Jack, give me one word that describes you, it would be teacher. I love teaching. And so I get a great fulfillment to seeing you as a person coming in with not a lot of confidence, but by the end of the day or the weekend, where you're excited about going home and offering something to your patients that you could never offer before with more confidence. Anytime that I would go take a course of this nature, the question that first comes to my mind as a student is, what qualifies this person to teach this course? And I have to give you a quote that my dad used to always give me. He goes, the experience is something that happened to you that you wish the heck had happened to somebody else. And it's the greatest form of education. And I have used a lot of these devices on a lot of patients that have not worked. And in fact, I've probably had more that didn't work than have worked. But now I'm reaching a point where I hardly ever have one that doesn't work. So it's through all those failures that we learned. I just don't want you to go through all those failures in the learning curve that I went through or some other people have gone through. It just didn't make sense to us to take a pig jaw or a piece of styrofoam. It really didn't even make sense to us to have you put a TAD in a friend of yours' mouth in the anterior region. That is so simple. You need another basic understanding of the anatomy, because we'll have you do a down fracture to look at the anatomy of where you placed your infrazygomatic TAD, for example, your palatal approach TAD. We'll have you dissect out the mental foramen. You gain so much confidence and so much knowledge and review of the anatomy, which you were taught in dental school, that then propels you right on in to take your focus from way out here and being really insecure to being much more secure. Just to add to the comment about what I have gained from the courses, two things. It wasn't until I had probably placed 800 or 900, or maybe not that many, I don't remember, several hundred of these devices prior to us starting to offer this Cadaver course. It wasn't until we started really dissecting out these devices that I didn't fully understand the anatomy or even what I was doing. And in fact, I'll read articles sometime about people have writing articles on experts on TADs, and I realized that person probably really hasn't looked at that many cadavers recently. And so I have gained a wealth of knowledge and continue to every time we teach one. But probably the most gratifying thing for me is some of what I consider the best orthodontists in the world, and we do have several people internationally that attend this course to come, that I'm very humbled to have, because they're far better orthodontists than I ever thought about being, to finishing cases and diagnosing cases. And to see them go home and then give me input back how much it's benefited them has been very humbling to me. So I would think that the humility that I have gained from teaching these courses has been a great benefit to me personally. The past 6 or 7 years have been really exciting to me in our profession to be a part of. Skeletal anchors is not anything new. There's nothing new in orthodontics, but the development and use of these obviously has been up front in all the articles and around the globe. And it's been exciting to me to be able to be a part of that, of the teaching process of doing that. And I mentioned that one word I would describe myself as a teacher. Another thing I just want to explain in a brief statement is that I'm certainly no big shot. I'm just a little shot that's kept on shooting. And I watch people when we first walk into that lab, and I see maybe how timid they are, even on a fresh specimen, how timid they even be. But at the end of the day, when they do that down fracture and they're placing TADs, and I just watch them grow so much. So that's the most fulfillment I get from the courses. And then when they send me pictures back 4 months later of patients that they've treated and been able to do, then it really cements that for me, that this is worthwhile and worth continuing to do. Another benefit to the Cadaver course is not so much what you see or read in textbooks, but what you feel. Let me give you a word picture or metaphor. I'm a pilot. You could be an aeronautical engineer and know all about flying, but until you sit next to some old timer that's flown those planes a lot, and you sit there and feel it yourself, you don't become a pilot. And you're not going to become somebody that can use TADs until you sit there and do a bunch of them yourself. I don't care who the teacher is or what textbook or what articles you read. You've got to get in there and learn what it feels like to for example, seat that base. And it's not until you do that down fracture and you dissect that out and you look at it that you understand exactly what you're feeling when you place it. The Cadaver Course gives you the didactic skills in placement of the TADs. It gives you the protocol placement of different areas of the mouth. It gives you the confidence and the competence to go back home and place them on your patients. This course is for any orthodontist wanting to expand on their knowledge and their didactic skills for the placement and use of orthodontic mini implants. We suggest and encourage people to bring their oral surgeon or periodontist if you are not particularly interested in placing these yourself, and even your assistant or your patient treatment coordinator to come with you, because they're vitally important as you start implementing this into your practice. I just want to add right here, we'll spend a considerable amount of time in the course hopefully teaching you how to implement these devices into a busy practice, which can be a challenging thing to most people mentally. And so we will also talk to you in the course about some of the mental challenges that you're going to face with the transitioning of this into your practice. So I look forward to seeing many of you in the Cadaver Course. We have a lot of fun and it's pretty intense learning.